It's been less than a week since President Joe Biden ordered sweeping new federal vaccine requirements for as many as 100 million Americans. Meantime, there are reports that the FDA may authorize COVID-19 vaccines for kids. Emory University's Dr. Winawer joins us live now with the latest on vaccine mandates and the boosters. Good morning to you, Dr. Winawer.
Good morning, Portia.
Good to see you. Let's dive right in. Last week, the president laid out new plans to fight the latest coronavirus surge, imposing stringent new vaccine rules on federal workers, larger employers, and the healthcare staff. Why the policy change and why now?
I think they felt they needed to take action. They were hoping to have more people vaccinated, and that hasn't been the case. And also last week, the CDC published data saying that if you're unvaccinated, you're 4.5 times more likely to be infected, 10 times more likely to be hospitalized, and 11 times more likely to die. So they felt with our hospitals being overrun, healthcare workers really exhausted, and 1,500 people dying per day on average, that something had to be done. And I know this is not going to be popular with a lot of people, but there's precedent for it. When we look back, we mandate measles, mumps, rubella, pertussis, tetanus vaccines in our school-age kids. Even going back to the Revolutionary War, President George Washington mandated smallpox vaccination or inoculation, saying that if the disease took hold in the troops, it would be worse than the sword of our enemies. So this goes back. There's precedent for it. It's going to be fought in the courts. But personally, I think that the job of the government in this situation is to provide for the general welfare of the populace. And with 1,500 people dying a day from the Delta variant, I think we needed to take action.
All right. Let's talk about the study. A new study reported by the CDC last week shows the Moderna vaccine was most effective in preventing hospitalization. Those Moderna recipients were 95% protected, whereas the Pfizer vaccine patients were at 80%. Johnson & Johnson, 60%. Is there some cause for concern here with those wide differences?
Yeah, this was another report that the CDC put out last week. And as far as the 2-dose vaccine, I don't think there is still very good protection from severe illness, hospitalization, and death. The Johnson & Johnson, certainly it gets your attention at 60%, but that's why we're talking about boosters as well. And when J&J, you certainly will need a second shot and possibly even a third. We'll have to see as the data emerges. But definitely that's why there's a need for booster shots as well. But I think this shows with the 2-dose vaccines, still very good protection.
All right, and some of the administration have stated not to expect a vaccine for children between the ages of 5 and 11 until after the new year. But there's some top U.S. health officials who say that Pfizer's COVID-19 vaccine will be approved by the end of October. What are parents to make of the conflicting information there?
Yeah, well, there's emerging information that Pfizer may submit their data for emergency use authorization to the FDA by the end of the month. If that happens, usually the process will take 3 to 4 weeks. So I think I'm predicting that around Halloween, plus or minus a week or two, we'll be seeing approval for Pfizer. Moderna will be another 3 or 4 weeks after that, but hopefully we'll be able to offer the Pfizer vaccine to our 5 to 11-year-olds sometime at the beginning of November.
Okay. All right. The coronavirus, the vaccines, the boosters, always new developments day to day, week to week. We appreciate you keeping track of all of it, Dr. Winawer.
It's my pleasure. Have a great week. I'll see you soon.
Okay. Good deal. Thanks. You too.